So if you've ordered a test to be delivered to your address, this is what you'll receive through the post. So we'll take a look inside and see what's there. So this is a unisex kit. It can be used by anyone and has a number of sample collections: blood, throat, rectal, vaginal and a urine sample. So this is the contents of the box. There are a variety of samples here, which we'll go through how to use them. And there is also two leaflets inside the box. One is how to collect your samples, and the other is to put your details on to ensure that you get your results back. The first sample we're going to look at is blood. And this is a test for HIV and syphilis. So the kit that we need is these finger prick tests in the finger prick lances inside the plastic bag, and there is a plaster in there and an alcohol swab to clean the finger beforehand. And the other items that we require are the collection sample bottle, and once we've collected the sample, we're going to put it in this protective packaging for sending away for analysis. I'm using a tray just for ease of use, but you're going to be doing this test at home, and so as long as you lay everything out in a clean environment, we can begin the test. I've washed my hands, and so we're now ready to perform the test. The instructions for collecting the blood sample are in the kit, and they are easy to follow, but we'll just do a practical demonstration now. So now I'm ready to perform the test. I'm going to open the bag with the finger prick lancers in, and we're going to take one and activate it. To activate it, we just unscrew the cap, and then the lance should be there underneath. Once I've done the finger prick and I've got some blood to flow, we're going to drip the blood into this container. And you can see on the side, it's marked 400 and 600. We are going to fill the container with blood to the 600 mark. If the sample is below 400, they may not be able to get an accurate test from this. And so if you are having difficulty getting blood, that's what the other two lances are for, so that you can do another finger prick and get some more blood to fill to the 600 mark. A handy tip to help the blood flow easier is to maybe take a hot shower before doing the test. Okay, so let's perform the test. Open the alcohol wipe and clean the area that you're going to take the sample from. I'm going to use the side of the finger. Twist off the cap and then press the lance against the finger, and then wipe the first bit of blood, open the bottle, and then drop the blood into the bottle. So we now have the sample, and so you press the cap tightly onto the bottle and then turn it upside down 5 times, and then we're going to place it into the container. It's sealed within the container, and so we can send that back to the laboratory in the box. The next item in the box that we're going to look at is the throat swab. They are all labelled, and this says oral, and this is the throat swab. So first of all, remove this swab from the tube, and try not to touch any other surfaces with the tip so that we get an accurate sample. We're going to touch the back of the tip to the back of the throat, and in the instruction leaflet it has a diagram of where you're going to take the samples from. This can cause you to make some gagging sounds and such like, so I'm not going to demonstrate, but once you've taken the sample, pop it back in the tube and press tightly to close it. The rectal swab. You may think that this might not be a necessary test for you to perform. For people with vagina, any infection inside the vagina can infect the rectum. So wash your hands and unpack the kit, and on a clean surface, ideally in the bathroom. I guess that's where you're most likely to be when you're going to perform this test. And again, remove the swab from its tube and avoid touching any unnecessary surfaces. So break the seal again where the dotted line is and take out the swab. So firmly hold the swab 3 to 4 centimetres from the tip. So to give you an idea, I have a little scale here with centimetre markings on, and so 3 to 4 centimetres would be around that. Find a comfortable position and insert the swab 2 to 3 centimetres into your rectum. You're then going to rotate the swab 5 to 10 times in large circles against the inside of your rectum, and gently rotate the swab while slowly removing it. Once again, push the swab into the sample tube and squeeze tightly to close. We're now going to look at the vaginal swab. Again, it's clearly marked vaginal. Break the seal and take the swab out of the tube. Again, making sure that you don't touch any surfaces that may contaminate the sample. And then carefully insert the swab half a finger's length into your vagina. Now rotate the swab around inside your vagina 5 to 10 times and return the swab to the marked tube and press tightly to close. So, collecting a urine sample. This is a urine collection pouch, and so the instructions are clearly printed on the front. With clean hands, open the pouch, push out the base area so that it will stand up, then carefully use the pouch to collect your sample. Around 1/3 full should be enough, and then pour the sample into the tube and filter level shown on the tube. This is the tube, and you can see fill to this line is marked there. And so let's open the pouch and see how it is constructed. I'm using water for demonstration purposes. Unscrew the cap. We've got to the fill line. Screw the cap back on. And again, this goes in a transportation pouch. Just open like so. Close it up, and we have collected all of our samples. So now we're ready to send the samples back to the laboratory. This form you have to complete first of all and put your correct details on. Some people have been tempted to put their friend's name on, but of course it will add confusion if one of the tests come back positive, and it will be more difficult to identify you. So please put all of your correct details on the form. You then cut down this dotted line, and you're going to keep this part because it has all the details of the test that you've sent off, so that if there is any issues, you can track your test. So you're going to send this part back fully completed. This part you're going to keep, and then you're going to put the form back in the box, because the box is what you're sending all the samples back in. So place the samples that you've taken. You may not have taken all of the samples that were in the box. Discard any that you didn't use. The box has two security tabs at the top here. You're going to close the box and locate the security tabs. And then apply the security seal to seal the box. If you have damaged the box at all, use sellotape to as extra security to ensure that the box is safe to put into the post.